Hello everyone. WealthCare Inc.'s video will provide a deeper understanding about how healthcare quality is evolving in 2024. Quality improvement remains a top priority as we strive to deliver safe, effective, and patient-centered care. We'll explore practical strategies and specific quality measures that healthcare organizations are using to track and improve quality. Patient safety indicators, or PSIs, measure the frequency of preventable events that may harm patients. These indicators track issues such as post-surgical infections, pressure ulcers, and adverse drug events. Monitoring PSIs allows healthcare organizations to pinpoint risks and implement preventive protocols. Preventive care measures aim to keep patients healthy. Common examples include the rate of immunizations, screenings for conditions like cancer, and monitoring for chronic diseases such as diabetes. For example, cervical and colorectal cancer screenings help detect issues early, improving patient outcomes and reducing overall healthcare costs. Managing chronic diseases is critical. Measures include controlling HbA1c levels for diabetic patients, maintaining target blood pressure for those with hypertension, and monitoring asthma control in children. These measures ensure patients are getting consistent care to avoid complications. Medication adherence and reconciliation. Tracking medication adherence, particularly for chronic conditions, is essential. Metrics may include monitoring patients with diabetes on medication therapy or ensuring patients with cardiovascular conditions take prescribed statins. Medication reconciliation is equally important, reducing the risk of adverse drug interactions during care transitions. Readmission rates. Readmission rates for conditions like heart failure, pneumonia, and chronic obstructive pulmonary disease highlight the effectiveness of discharge planning and post-discharge support. A high readmission rate can signal a need for enhanced patient education and follow-up services. HEDIS and star ratings measures. HEDIS and Medicare star ratings cover a broad spectrum of care, from preventive screenings to management of chronic conditions. For example, controlling high blood pressure is both a HEDIS and star measure, directly impacting quality scores and financial incentives. HEDIS also tracks measures like follow-up visits after mental health discharges, which help prevent relapses. Well-child visits and weight assessment and counseling for nutrition and physical activity are important for infant and children's health, along with prenatal and postpartum care for expecting mothers. Patient satisfaction metrics are increasingly important. Surveys like the CAHPS, which stands for Consumer Assessment of Healthcare Providers and Systems, ask patients to rate their experience. These surveys cover areas like provider communication, wait times, and overall satisfaction. Positive patient experience not only boosts reputation but also aligns with high-quality care. ED throughput metrics include average wait time, time to triage, and length of stay in the emergency department. Shortening these times improves patient satisfaction and reduces overcrowding, ensuring that emergency services run efficiently. Infection control focuses on reducing hospital-acquired infections like C. difficile, surgical site infections, and bloodstream infections. By monitoring HAIs, healthcare teams can reinforce infection prevention protocols, keeping both patients and staff safe. Care coordination measures. Coordinating care across providers is essential, especially for patients with complex health needs. Quality measures here may include monitoring follow-up appointments after hospital discharge, transition planning, and the use of patient care summaries. Effective care coordination reduces unnecessary hospitalizations and improves overall care continuity. Behavioral health integration. As mental health becomes a priority, quality measures now assess how well behavioral health is integrated into primary care. Metrics include follow-up care after hospitalization for mental illness and depression screening in primary care settings. These measures improve mental health support and help identify patients at risk. Care for the elderly. Quality care for elderly patients focuses on dementia screening, managing chronic conditions, and fall prevention. Metrics often include the use of assistive devices and the rate of falls resulting in injury. As the population ages, these measures are crucial for providing safe and dignified care. End-of-life and palliative care measures. Palliative care quality measures ensure that patients receive appropriate support during serious illnesses. Examples include pain management and the documentation of patient care preferences. These measures promote compassionate care aligned with patients' wishes. Preventive screening for social determinants of health. Social determinants of health, like housing stability and food security, play a big role in health outcomes. Measures in this area might track screenings for SDOH-related needs, connecting patients to community resources. Addressing these factors is essential for comprehensive, patient-centered care. Staff training and patient safety culture. Staff training and cultivating a safety culture are increasingly monitored. Surveys assess whether healthcare teams feel supported and empowered to speak up about safety issues. A strong culture of safety can reduce preventable errors and improve staff satisfaction. These quality measures are just a snapshot of the areas that healthcare organizations focus on to enhance patient care. By monitoring and acting on these metrics, healthcare providers can work toward higher quality, safer, and more efficient healthcare. At WealthCare Inc., we're here to help you navigate and meet these quality benchmarks. Our goal is to empower healthcare professionals with the knowledge they need to prioritize quality in every area of care. Thanks for watching, and let's continue to make healthcare better, safer, and more effective for everyone.